Hello, team and partners at IHA. For those who I haven't met, my name is Courtney Wright, and I am a humanitarian worker representing Crop Corps. It is truly an honor to present this report, which will be highlighting the critical gaps and challenges affecting the migrant population in Pais Fronterizo. In addition to outlining the key challenges identified during our assessment, I will also walk through a set of recommendations aimed at reducing ongoing risk and vulnerabilities to ensure that the immediate needs of the affected populations are addressed in a timely and effective manner, while also strengthening the well-being and quality of life of the most vulnerable through the humanitarian crisis that we see on the ground. Now, I want you to imagine living in a neighborhood constantly surrounded by gangs, while the police repeatedly knock on your door, harassing you and your loved ones, accusing you of crimes that you did not commit, accusations that could lead to jail time or even serious harm to you and your children. On top of this, your town has just been devastated by a catastrophic hurricane, destroying local crops that your family rely on not only for income, but also for daily substance. Facing the harsh realities of economic instability, ongoing threats of violence, and food insecurity, you realize that you have no choice but to flee, seeking a place that might offer safety, stability, and a future for your children. This story is just a glimpse into the daily lives of many migrants, their hardship compelling them to travel for days without food, water, or security, all in pursuit of safety and a chance at a better life for their families. These circumstances have led thousands of migrants arriving in District Nuevo, where they hope to enter Independencia, but have been turned away by government authorities. As a result, many are forced to take shelter along the border in the migrant camp, a refugee Amor, forcing overcrowded conditions and limited access to essential services. So, in order to respond to the growing humanitarian crisis, over the past 8 days, my team and I have conducted an assessment in District Nuevo. We've surveyed over 200 individuals, interviewed local leaders, and observed conditions within the camp. Our goal was to identify critical areas requiring immediate support. And during our assessment, we discovered significant challenges in key systems, including health, food, shelter, and security, all of which require equal attention to ensure the affected population can maintain a dignified life. So food security remains a critical concern. During our routine visits to Camp Refugio de Amor, the team has observed migrants waiting up to 4 hours for a single meal. Additionally, the meals provided by the UN agency frequently do not align with cultural dietary practices, which have resulted to migrants discarding the food, leading to increased pest and unsanitary and negative health conditions within the camp. In many cases, migrants have also had to modify their own food, resulting to unsafe cooking methods such as using indoor gas canisters and burning plastic when firewood is unavailable. As you can imagine, these coping strategies have resulted in serious health risks like carbon monoxide poisoning and even reported deaths. As it relates to health and sanitation challenges, migrants within the camp are living in overcrowded conditions. The shelter itself is located alongside a polluted river, really limiting access to clean water and sanitation. As mentioned in the previous slide, food insecurity is also a growing concern, leading to digestive and other health issues. All of these challenges, which we talk about overcrowding, poor health hygiene, and inadequate nutrition, has increased the risk of disease transmission. Just recently within the camp, new cases of chickenpox and shingles were reported, highlighting an urgent need for better hygiene, medical care, and targeted health education. Lastly, I would like to touch on safety and security, which remains among the most pressing concerns for the migrant population. Despite fleeing political and gang violence in their home country, many migrants continue to face targeted attacks and hostility within District Nuevo. Just during a recent camp visit, we witnessed gunshots fired through the camp windows, which has terrified residents and staff. As you can imagine, the trauma brought on by attacks like this. Beyond these physical attacks of aggression, overcrowded shelter conditions have also intensified the tension within the shelter, while children are forced to play amidst rising conflict. Compounding these challenges, migrants frequently face barriers such as legal restrictions stemming from a lack of documentation and policies that have limited their access to economic opportunities and vital resources. As a result, they are often stereotyped as lazy or impoverished, which further undermines their ability to live a dignified life in the region. So now that we identified the challenges, I want to propose some solutions and provide recommendations to help combat some of the risk. As we get into food responses, it's really important to prioritize cash-based assistance, as this really allows migrants to address individual dietary restrictions and nutritional needs. It also strengthens local and regional markets. On top of this, humanitarian organizations can also provide proper cooking equipment and deliver training on safe and hygienic cooking practices. For long-term sustainability, the camp has a community garden that should be enhanced. Organizations can support this by supplying additional soil, seeds, and tools, enabling residents to engage in more productive and sustainable food production. These combined strategies really ensure that food security is maintained in a culturally effective and appropriate manner. Regarding health initiatives, organizations should procure and deploy additional wash stations, especially in kitchen and dining areas, to promote hand washing before preparing and serving food. Beyond this, it is recommended to establish additional mobile clinics with local staff being trained to manage future health concerns. Waste management systems should be strengthened, focusing on proper disposal practices to reduce the risk of bacterial diseases. And most importantly, culturally sensitive focus groups and information sessions should be expanded to educate individuals on safe health and hygiene practices. These combined strategies not only address immediate health needs, but also promote sustainable practices that strengthen the overall local capacity over time. Regarding safety and security, additional shelters should be constructed immediately, as requested by Father Torres. This is critical not only for safety, but also improving health and sanitation conditions. Children also need dedicated recreational spaces to play and find relief from trauma experience. Within the shelter, it is recommended to also have a family support liaison and a trauma specialist on site to address mental health concerns. Additional efforts should focus on building partnerships with local organizations to provide job training, placement, and entrepreneurship programs for both migrants and local residents. This will reduce competition and foster community cohesion. Finally, it is extremely vital that organizations coordinate with local media and authorities to address protection concerns, to combat misinformation, and strengthen the community's shared understanding. It is absolutely essential that throughout these planned initiatives, we continue to listen to the voices most affected. This includes migrants in the camp, local leaders, and local organizations, all of whom have a vested interest in seeing a speedy recovery in their community. During one of my interviews, I was reminded by Vinny that clusters truly save lives, but they require patience and trust. Respect partners' strengths, even if methods differ. Listen more than lecture. Lead by example, not by demands. Progress happens through relationships. We must remember that our partners play a critical role in strengthening both local and international collaboration. They mobilize volunteers across different sectors, engage community members by leveraging their skills and talents, and educate donors on context-specific needs. Additionally, they help foster a shared commitment to building networks and support community infrastructure that enhances overall community resilience. Ultimately, by integrating these practices and mitigation strategies and establishing strong monitoring systems, humanitarian organizations and their partners can strengthen resilience, reduce service disruption, and promote sustainable positive outcomes for the vulnerable migrant population in Pais Fronterizo. Thank you so much.